Leukemia. Biology 54. San Jose State University. Instructor Mary Poffenroth. Summer session 2015. What is leukemia? It's a cancer of the blood which originates in the bone marrow where blood cells are made. Acute leukemia is when a rapid increase in the number of immature cells is present. Crowding of immature blood cells disables the bone marrow from producing healthy blood cells. Happens more often in children. The accumulation of malignant cells occurs rapidly, requiring immediate treatment. Chronic leukemia is when excessive number of matured and abnormal white blood cells are produced. Slow to progress, may produce more cells than its normal rate, resulting in the accumulation of abnormal white blood cells. Normally occurs in older people. Lymphoblastic lymphocytic leukemia affects the white blood cells lymphocytes, which are infection-fighting immune system cells. Myeloid or myelogenous leukemia affects the white blood cells, myelocytes, platelets, and a type of red blood cell. Symptoms of leukemia are fever and chills, night sweats, fatigue and muscle weakness, weight loss, lack of appetite, recurrent nosebleeds, swollen lymph nodes, and enlarged liver, bone or joint pain, formation of tiny red spots or purple blotches on the skin. Treatment options were chemotherapy, radiation therapy, stem cell transplant, clinical trials, and other treatments including surgeries, biological therapy, and targeted therapy. A new way to treat leukemia identified a mode of cancer recognition by the immune system. It's called immunotherapy. Scientists have learned that instead of fighting the cancer with drugs, that they can harness the body's own immune system to destroy the cancer cells using lipids. By recognizing the lipids, the immune cells stimulate an immune response to destroy the leukemia cells and suppress their growth. The detection triggers an immune response that activates the T cells in the body to kill the leukemia cells and limits cancer progression. Lipids and cancer cells do not differ between individuals, and this suggests a treatment that is effective in all patients. Up to this point, proteins have been utilized to attack the cancerous proteins in the leukemia cells. Chemotherapy has side effects: fatigue, hair loss, nausea, anxiety, and depression. There is an anti-leukemic agent, a compound found in many gout treatments and over-the-counter products used to treat warts, which also prevents cell growth. The agent is able to reach cancer cells before they mature, so catching the disease in its early stages will eradicate it quickly. This is especially vital for acute myeloid leukemia, which progresses rapidly without treatment. A cancer of the blood, leukemia is thought to survive and grow through the action of leukemia stem cells, LSCs, which multiply within bone marrow. Here they face competition for resources with hematopoietic stem cells, HSCs, which are responsible for producing and maintaining all the different varieties of healthy blood cells within the body. An initial attempt was made to model competition between these two types of cells using methods from the world of ecology. Two cellular species who directly compete against each other for resources, and the models analyzed how that competition play out within the biological niche of the bone marrow. They found that the greatest chance of beating leukemia came from maintaining a healthy population of hematopoietic stem cells rather than trying to eradicate the leukemia stem cells directly. Maintaining health is more likely to eradicate leukemia than fighting leukemia directly without taking care of the healthy stem cells, the researchers discovered. A peptide vaccine can produce a complete molecular remission in some patients with myeloid leukemia. The PRL peptide is naturally occurring in normal bone marrow cells, and since the target problem is overexpressed on leukemia cells, it directs immune T cells to kill the leukemia and leave normal cells alone. Like many vaccines, the body creates an immune system memory for the PRL peptide, conferring long-lasting protection. Patients get the vaccine 3 times. An immune response was measured 4 years after treatment in some patients. Some leukemia cancer cells remain after the patient is treated and hide in the body. It is those lingering leukemia stem cells which stubbornly resist existing therapeutics that fuel cancer's comeback. The drug imatinib inhibits the oncoprotein that drives chronic myeloid leukemia, and it is incredibly effective at putting patients into remission, but it doesn't rid the body of the most immature cancer cells. New research has revealed leukemia stem cells and normal stem cells travel different pathways. This makes it possible that it just might get rid of leukemia and its stem cells once and for all, while leaving healthy cells unscathed, giving an angle for therapy. The early developmental pathway is important during development, but not in adulthood. Leukemia stem cells revert back to their dependence on that early developmental pathway. Leukemia stem cells are vulnerable to treatments aimed at the so-called beta-catenin pathway in a way normal blood stem cells aren't. For acute lymphoblastic leukemia, or ALL, scientists and researchers have discovered a frontline chemotherapy using the proteins asparaginase and glutamate to attack asparagine and glutamine, 2 cancerous proteins in leukemia. Most leukemia cell lines were more sensitive to isoforms with higher glutaminase activity, indicating glutaminase activity may be required for full anti-leukemic efficacy. The right combination of these leukemia-fighting proteins must be determined and weighed against the potential side effects. Side effects from this treatment may include immunosuppression, pancreatitis, and intestinal damage. Using the right amount and potency of these proteins is crucial, therefore. A drug, fjordazine, successfully kills cancer cells in the human while avoiding the toxic side effects of conventional cancer treatment. It kills cancer stem cells by changing them into cells that are non-cancerous. The drug appears to have no effect on normal stem cells. A new strategy and discovery pipeline for the development of anti-cancer drugs in the treatment of various cancers looks promising. For 15 years, some researchers have believed stem cells are the source of many cancers. In 1997, Canadian researchers first identified stem cells in certain types of leukemia. Cancer stem cells have since been identified in blood, breast, brain, lung, gastrointestinal, prostate, and ovarian cancers. Now the scientists can test thousands of compounds, eventually defining a candidate drug that has little effect on normal stem cells but kills cells that start the tumor. And T-cell immunotherapy may serve as a complementary treatment for a more effective and safer therapeutic approach towards leukemia. Here you can see a stem cell, a blood stem cell. On the left is a myelogenous cell, and the right is a lymphoid stem cell. And the myeloblast is on the left with the red blood cell on the lower left, the platelets next to that, myelocytes next to that, and then on the right is the lymphocyte and the white blood cells you can see marked by the